Hey there, getting a new diagnosis, especially one with a complicated name like ischemic colitis, can be, well, a lot to take in. It can feel confusing, maybe even a little scary. And if you've been online, you know there's a ton of information out there. That's why we're here, to cut through the noise and give you a simple, clear guide so you can feel confident and really understand what's going on.
We've put together a really straightforward roadmap for our chat today. First, we're going to tackle what ischemic colitis actually is. Then we'll get into why it might have happened. After that, we'll walk through how doctors figure it out, cover the treatments, which are usually very effective, and finally talk about what you can expect down the road. All right, so let's start with the absolute basics. What in the world are we even talking about when we say ischemic colitis? Let's get a nice, clear definition.
Okay, let's make this super simple. Imagine the blood supply to your colon is like a garden hose watering your plants. Now, ischemic colitis isn't like someone came and cut the hose. No, it's more like a temporary kink that just slows down the water for a little while. That brief dip in blood flow to the tiniest vessels in your colon is what leads to the inflammation and the symptoms. It's temporary.
Now, this next part is really, really important. We need to talk about what ischemic colitis is not. If you've been doing some searching online, and we all do it, you might have bumped into the term mesenteric ischemia. It sounds kind of similar, right? But they are completely different things. Mesenteric ischemia is a major vascular problem with the big blood vessels, and it often means emergency surgery. Your condition, ischemic colitis, involves the small vessels. It's usually temporary, and guess what? Most of the time, it's treated without any surgery. So let's be super clear, they are not the same.
So that leads us right to the next big question you're probably asking. Okay, so why me? Why did this happen? It really helps to understand the causes and risk factors. It takes away a lot of the mystery. You know, your colon's blood supply system is pretty amazing, but it has these spots called watershed areas. Think of it like this. If you have a really long sprinkler system, the sprinkler at the very end of the line is the one that gets the least water pressure, right? Well, these watershed areas in your colon are at the very end of their blood supply line. So if your body's overall blood flow dips for any reason, these are the first spots to feel it. That's why ischemic colitis tends to show up in these specific places.
And it's so important to hear this. This condition is not your fault. It's not about something you did or didn't do. As you can see here, it's often tied to other things. It does get more common as we get older, and it can be linked to other medical conditions that might affect circulation, or sometimes it happens after a big surgery. It's all about situations that can cause that temporary dip in blood flow we talked about. Okay, so how do doctors actually connect the dots and figure out that this is what's going on? Let's walk through the steps they take to go from those first symptoms to a solid diagnosis.
The whole diagnostic journey usually follows these 4 key steps, and it really starts with you. That sudden belly pain and some bleeding are often the classic first clues. Then, your doctor will do an exam and probably notice that the area is tender. The next step is usually a CT scan, which can show the inflammation and swelling in the colon wall. And the final piece of the puzzle is often a colonoscopy, which lets the doctor take a direct look inside and see exactly what's happening. Now, you might hear your doctor use a kind of funny-sounding word, thumbprinting. It sounds a little weird, but it's just a name for a classic visual sign they look for. When the wall of the colon gets all swollen and inflamed, it can create these little indentations on a scan that look just like someone pressed their thumbs into it. It's just one of those telltale signs that helps them confirm what's going on. All right, now for the most important part, the path forward. Let's talk about treatment and recovery. And I've got great news here, because for most people, the plan is really straightforward and works incredibly well. I really want you to let this number sink in for a second. More than 80% of people with ischemic colitis get better with simple supportive care. That means no surgery. Surgery is the exception, not the rule. This is a very treatable condition. In most cases, your body just needs a little help and the right environment to heal itself. So what does that supportive care actually look like? Well, it's all based on some pretty simple logic. First up is bowel rest, which usually just means not eating or drinking for a little while. This gives your colon a much-needed break so it can heal. Second, you'll get IV fluids to make sure you stay perfectly hydrated. And third, you'll likely get some antibiotics, just as a precaution to make sure no nasty bacteria causes secondary infection while the colon wall is vulnerable. So, you've gone through the treatment, you're starting to feel better. What happens now? What's life look like after this? Let's talk about the long-term outlook. The good news is the healing process is usually pretty quick and predictable. Most people start feeling a lot better in just a day or two, and within about 1 to 2 weeks, the inflammation is typically gone completely. Now, in a few cases, a little narrowing or stricture can form as things heal, but even those often resolve all by themselves over the next year or so.
Looking at the big picture, the prognosis is really, really good. As you can see, the most common outcome, by far, is a full recovery. That's the path for about 2/3 of patients. For a smaller number of people, some chronic inflammation or a stricture might pop up later on, but those are things your doctor can keep an eye on and manage. The key thing to remember is that a full recovery is the rule, not the exception.
So, as we wrap this up, I want to leave you with a little piece of homework. Think about this. What is one question you can ask your doctor at your next appointment to help you feel more empowered and in control of your recovery? Because being an active part of your own healthcare team, well, that's the most powerful thing you can do. Thanks so much for joining us.